Assalamualaikum and very good morning to everybody. My name is Haryanti Azura from Animal Experimental Unit. I hope you all having a wonderful morning so far. It is my distinct pleasure to introduce our esteemed speaker for today's session, Dr. Azmina binti Mohamad Zailan. Dr. Azmina brings experience and knowledge to our discussion today as a veterinary officer from Animal Experimental Unit or AEU. Her expertise spans both the clinical and research aspects of veterinary medicine, making her exceptionally qualified to address our topic, selecting an appropriate animal model for human disease. Throughout her career, Dr. Azmina has demonstrated a deep commitment to advancing understanding of disease, mechanisms, and therapeutic interventions. Her insights have not only contributed to the welfare of animals, but also to the development of translational research that holds profound implications for human health. Today, we are privileged to have Dr. Azmina with us to share her expertise and shed light on the complexities involved in choosing the most suitable animal models for studying human diseases. I have no doubt that her presentation will be enlightening and offering us valuable insights into these critical aspects of biomedical research. Without further ado, please join me in extending a warm welcome to Dr. Azmina.
Okay, so thank you, Puan Atika. Assalamualaikum and good morning to all of you. My name is Azmina and I am delighted to stand before you today as a representative of the Animal Experimental Unit at the Faculty of Medicine in Himalaya. So today I'll be diving into a critical aspect of medical research, which is the selection of the right animal model for human disease study. So our focus today will revolve around the diverse array of animal models that are available in our facility, emphasizing those commonly employed for the study of prevalent human diseases. So while we cannot cover every conceivable animal model in the limited time we have, so I aim to provide you with a comprehensive overview that will empower you to make informed decisions for your research. So together we will explore the characteristics of various animal models, their strengths and their limitations, with a specific focus on those readily available within our lab animal facilities. So in the realm of medical research, the use of animal models has proven to be an invaluable tool offering a unique avenue for investigating diseases in ways that will be ethically or practically possible in human patients. So we explored the crucial role of animal models in medical research, highlighting their ability to mimic human diseases through existing inbred or induced conditions. So existing models such as certain mouse strains predisposed to diseases like diabetes provide a natural platform for studying disease progression, and inbred models created through genetic uniformity are very valuable for dissecting diseases with known genetic components like cancer. And induced models where diseases are deliberately introduced allow precise control for studying specific conditions, such as inducing arthritis in rodents to explore inflammatory processes. And these approaches address the ethical and logistical challenges of studying diseases directly in humans. And animal models offer a controlled environment and also enabling researchers to manipulate variables, observe disease progression, and also test interventions without risking harm to human subjects. And overall, the use of animal models provide a unique opportunity for scientific exploration and also allowing researchers to uncover the intricacies of disease states and identify underlying mechanisms and also test hypotheses responsibly and rigorously. And as we explore the various animal models in our facilities, let's appreciate the distinct advantages each brings, offering a valuable lens to gain deeper insights into the complexities of human diseases. So the animal models play a crucial role in medical research as they provide a means to study and understand complex biological processes, diseases, and potential treatments before moving on to human trials. So the importance of animal models in medical research can be summarized as follows. So basic biological understanding, animal models actually help researchers gain insights into fundamental biological processes, which can be very difficult to study directly in humans because of the ethical and practical considerations. So, by studying animals with similar genetic and physiological characteristics to humans, scientists can unravel the mechanisms underlying various physiological functions, developmental processes, and also disease pathways. And the next is the disease mechanisms and pathways. So animal models allow researchers to mimic diseases in controlled settings, helping them understand the causes, progression, and also mechanisms behind various illnesses. And this knowledge is very essential for developing new treatments and also interventions. So, for instance, animal models have been instrumental in understanding cancer, neurodegenerative disorders like Alzheimer's and Parkinson's, and also cardiovascular diseases and many more. Okay, so next one is the drug development and testing. So before new drugs or therapies can be tested in humans, so they undergo rigorous testing in animal models in order to evaluate safety, efficacy, and also potential side effects. So this helps identify potential issues early in the development process and prevents exposing humans to potentially harmful substances. Okay. Next one is the treatment validation. So animal models are used to validate the effectiveness of new treatments, surgical procedures, and also medical devices. So this ensures that interventions are likely to work before they are tested in humans, saving time, resources, and also reducing the risk of adverse outcomes. Okay, and last one is the genetic manipulation, meaning that advance in genetic engineering will actually allow scientists to create animal models with specific genetic mutation or alteration, mimicking genetic conditions that is found in humans. So this enables researchers to study the effect of this mutation and also explore potential treatment. Okay, so choosing suitable animal models for human disease studies involve systematic approach to selecting the most appropriate animal species and models that closely mimic the characteristics and mechanisms of the human disease being investigated. So this concept revolve around several key considerations. The first one is disease relevance. So the animal model should replicate the key features, symptoms, and also progression of the human disease as closely as possible, because the chosen model should exhibit similar physiological, anatomical, and biochemical characteristics relevant to the disease. Okay, secondly is the physiological parallels. It actually considered the similarity of the animals models physiological systems to those of humans. So models with comparable cardiovascular, respiratory, immune, and nervous systems are more likely to provide insights into disease processes and potential treatments. Okay. Next one is the response to the treatment. So animal models should respond to therapeutic interventions such as drugs or treatments in a manner similar to human patients. And this enables researchers to test potential treatments and assess their efficacy and also safety. Okay, so next one is pharmacokinetics and pharmacodynamics. So consider how the animal model metabolize drugs and responds to therapeutic agents. Similarities in drugs absorption, distribution, metabolism, and also elimination enhance the translatability of results to human drug responses. So next is the challenges in human diseases study. So in terms of the ethical constraints, so human research involves ethical concerns regarding the potential harm, informed consent, and also privacy of participants. So researchers must prioritize the well-being of participants and adhere to strict ethical guidelines, which can limit the scope and also design of the studies. Okay, second one is the complexity of human systems. So human physiology is highly complex with numerous interconnected factors influencing health and also disease. So isolating and manipulating individual variables can be challenging, and it's often difficult to discern causality due to the multifaceted um, nature of the human biology. And the third one is the variability in disease progression. So diseases often manifest differently in different individuals, and the cause of a disease can vary widely. So this variability can make it challenging to identify persistent patterns or mechanisms hindering the development of targeted treatments. So using animal models for control experimentation offers a range of benefits that contribute to our understanding of biology, diseases, and potential treatments. So while ethical consideration must guide the responsible use of animals in research, so animal models remain an essential tool for advancing scientific knowledge. So here are some key benefits in terms of the biological similarity. So again, many animals have they share physiological and genetic similarities with humans, allowing researchers to investigate fundamental biological processes, pathways, and also mechanisms that are relevant to human health and also disease. So this similarity provides a basis for studying diseases, drug responses, and also interventions in a controlled environment. Okay, so next one is the controlled environment. So animal experiments allow researchers to create, control, and standardize conditions, minimizing external factors that can complicate the interpretation of the results. So this control environment is very essential for understanding the specific effects of variables being studied. Okay, and third one is the manipulation and observation. So animal models enable researchers to manipulate variables, for example, genetics, environment, diet, and observe their effects over time. So this ability to isolate specific factors actually contributes to the establishment of cause and effect relationships and the identification of critical factors in complex biological systems. Okay, so next one is the ethical considerations. So again, in many cases, using animal models can be more ethical than conducting experiments on humans. So it allows researchers to gain insights into mechanisms and potential risks before progressing to human trials. So ethical considerations, however, should always prioritize minimizing harm to animals and using alternative when possible. The next one is shorter lifespan. So animals often have shorter lifespans than humans, enabling researchers to observe the effects of interventions and treatments over a relatively compressed time frame. So this is particularly advantageous for longitudinal studies and assessing long-term outcomes. And next one is the reproducibility and standardization. So animal models offer a level of experimental reproducibility that is challenging to achieve with human subjects due to the variability in genetics, lifestyle, and also environmental factors. So this reproducibility enhance the reliability of research findings. Okay, so next one is the drug development and safety testing. So animal models play a crucial role in preclinical testing of potential drugs and therapies. So they allow researchers to evaluate safety, efficacy, the dosage, and potential adverse effects before advancing to human clinical trials. Okay, so next one is the disease modeling. So animal models help researchers simulate and study various diseases, providing insights into disease progression, mechanisms, and also potential interventions. So this knowledge is fundamental to developing new treatments and improving existing ones. Okay, so let's move on to the animal model for pharmacology and toxicology and also immunology studies. So in pharmacology and toxicology research, so various animal models are employed to study the effects of drugs and chemicals. So for mice, strains such as ICR, Babsy, and also black mice are commonly used due to their versatility and well-established genetic background, and these traits have been extensively studied and characterized, so making them suitable for a wide range of research applications. And similarly, for rats, SD rats, and also WKY rats are frequently used as animal models. So for SD rats, they are known for their robust health and also adaptability to lab conditions, whereas for WKY rats, they are valued for their genetic homogeneity and susceptibility to certain diseases. And in addition to mice and rats, so New Zealand white rabbits are also commonly employed in pharmacology and also toxicology studies. As rabbits, they offer several advantages, such as larger size for blood and also tissue sampling, and a more complex physiology that more closely resembles humans compared to rodents. Okay, so for animal models in pharmacology and toxicology research, so various animal models are employed to study the effects of drugs and chemicals. So for mice, strains such as ICR, Babsy, and also black mice are commonly used due to their versatility and well-established genetic background, and these strains have been extensively studied and characterized, so making them suitable for a wide range of research applications. And similarly, for rats, SD rats, and also WKY rats are frequently used as animal models. So for SD rats, they are known for their robust health and also adaptability to lab conditions, whereas for WKY rats, they are valued for their genetic homogeneity and susceptibility to certain diseases. And in addition to mice and rats, so New Zealand white rabbits are also commonly employed in pharmacology and also toxicology studies. As rabbits, they offer several advantages, such as larger size for blood and also tissue sampling, and a more complex physiology that more closely resembles humans compared to rodents. Okay, so for animal models in immunology studies, so a variety of mouse strains can be used, including skin and all these KIT, OPSI, and also C57BL sets. So these strains are considered multi-purpose models because of their versatility in various immunological studies. But please note that our facility currently doesn't have skip-on and or these skip mice strains available. And for rat models, SD rats or WKY rats are suitable choice. However, our facility also doesn't have the Lewis or Fisher rat available. And New Zealand white rabbits, as you can see, they are not generally considered as appropriate for immunology studies because of their limited immunological responses compared to the other animal models. So in this image, you can observe our user conducting infectious animal work at our facility. So here at the Animal Experimental Unit, we have a dedicated ABSL2, Animal Biosafety Level 2 for all infectious work. So as depicted in the picture, any activities involving infectious animals must take place within a biosafety cabinet, and the user is required to wear an N95 face mask. So relatively common infectious animal studies conducted at AEU include research on the dengue virus EV71, cobra venom, Staphylococcus aureus infection, chikungunya using mice strains. Okay, so next up is animal model for diabetic disease. So within this realm, type 1 diabetes can be effectively divided into two categories. Those induced chemically using a powerful agent known as streptozotocin, STZ, and also those involving genetic animal models. So let's delve into the chemical induction aspects. So where STZ plays a pivotal role in mimicking the onset of type 1 diabetes in animals, predominantly rodents. So STZ, which is a commonly used chemical in diabetes research, works by selectively damaging and they will destroying insulin producing beta cells within the pancreas. So this process mirrors the autoimmune destruction observed in human type 1 diabetes. So as a consequence, the destruction of beta cells leads to insulin deficiency, resulting in elevated blood sugar levels and also the manifestation of the diabetes symptoms. Okay. And now let's shine a spotlight on some of the common use animal models within this chemical induction paradigm. So mice, particularly strains such as ICR and Zubapsi, and rats, including the sprout dolly rats, are frequently employed in this line of research. So both ICR and SP rats belong to the outbred type of the animal strains, making them versatile and also multi-purpose animal models. Okay. Now let's dive into the practical side of the research. So researchers commonly follow a specific protocol for chemical induction using STZ. So typically they intraperitoneally inject STZ at the low dose of 35 mg per kg into the animals, and subsequently they monitor blood glucose levels on a weekly basis. So this involves pricking the rat's or animal's tail using a lancet and withdrawing a drop of blood and placing on a test strip of blood glucose measurement kit. And a critical threshold for considering an animal diabetic is a non-fasting glucose level exceeding 300 mg per dl. And in cases where the first induction fails, so the researchers often opt for a second injection of STZ at the same dose after a 3-day interval. Okay. So in the context of type 1 diabetes, genetic models have been instrumental in elucidating the complex interaction between genes and the immune system that leads to this autoimmune disorder. So by modifying genes involved in immune regulation of pancreatic beta cell function, researchers actually have developed animal models that exhibit hallmarks of type 1 diabetes. So one such example is the DBTB mouse strain, which carries a mutation in the leptin receptor gene. So this mutation leads to hyperphagia and obesity, and as a result, the mice will develop beta cell dysfunction and insulin deficiency, closely resembling the metabolic abnormalities observed in type 1 diabetes patients. And genetic animal model actually provide several advantages for studying type 1 diabetes. They allow researchers to study the direct effects of gene mutations on disease development and progression, enabling a deeper understanding of the underlying mechanisms of the disease. And additionally, these models can be used to test the efficacy of a new therapeutic strategies targeting specific genes or pathways involved in disease pathogenesis. So this image depicts a DBDB mouse that is utilized in our researchers' investigation. So the study seeks to assess the efficacy of a new biomaterial in enhancing wound healing for individuals with chronic wounds, that is impact wound healing due to the diabetes and also acute wounds. So as observed, the dorsal region of the mouse was shaved and a wound was inflicted. So the scaffolds were promptly applied to the wound and sutured immediately following the wound creation. Okay, now when it comes to type 2 diabetes, we can categorize it into two main models. That is diet-induced obesity and chemical induction. So in the case of diet-induced obesity models, the objective is to induce obesity and insulin resistance, both crucial elements in type 2 diabetes, by feeding the animals, typically rodents, which is a high-fat or high sugar diet. So the underlying mechanisms involve a prolonged exposure to a calorie-dense diet, resulting in weight gain, insulin resistance, and also the manifestation of diabetes-like symptoms. So the ultimate outcome is the development of type 2 diabetes features, including elevated blood sugar levels, insulin resistance, and also metabolic dysfunction. And on the other hand, chemical induction involves a combination of a high-fat diet and STZ in order to induce diabetes. So here the high-fat diet contributes to obesity, and insulin resistance, while the chemical agent may further hinder the insulin production or function. So this approach results in animals developing a model that combines characteristics of both obesity-related insulin resistance and also pancreatic dysfunction, closely resembling type 2 diabetes. And in both categories, commonly used animal strains include SD rats and also ICR or biopsy mice, chosen for their versatility as multipurpose animal models. So one example of a specialized diet is the high-fat diet. So as you can see, it comes in various colors. Typically, researchers will adjust or manipulate the calorie and fat contents, increasing them to be administered to the animals. So the animals undergo a feeding regime with the high-fat diet for approximately 2 to 3 weeks, a period during which diabetes is induced. Okay, so let's move to the animal model in hypertension cases. So moving on to animal models used in hypertension studies, which is the spontaneously hypertensive rat SHR, stand out as a prominent animal model. So these rats exhibit several characteristics features that closely resemble human hypertension, where they develop hypertension around 6 to 7 weeks of age, reaching stable systolic blood pressure levels of 180 to 200 nm Hg by 17 to 19 weeks. So these rats exhibit heightened vascular reactivity and sympathetic nervous system activity, coupled with impaired endothelial function and increased sodium retention. So SHRs serve as valuable tools for researchers studying the mechanisms of hypertension and exploring potential therapeutic interventions. So their genetic predisposition to hypertension, coupled with their physiological similarities to human hypertension, makes them an essential model for understanding and addressing this prevalent cardiovascular condition. So, SHR rats offer several advantages as an animal model for hypertension research. So, the first one is the spontaneous and sustained hypertension. So, SHRs develop hypertension spontaneously and maintain elevated blood pressure levels throughout their lifespan, mimicking the chronic nature of human essential hypertension. So, number two is the ease of breeding and maintenance. So SHR rats are relatively easy to breed and maintain in lab settings, making them a cost-effective and practical choice for research studies. Okay, so next one is the well-characterized genetic and physiological profile. So the genetic and physiological characteristics of SHR rats have been extensively studied, providing researchers with a comprehensive understanding of the underlying mechanisms of hypertension in this model. Okay, and they are widely used in hypertension research, resulting in a vast body of literature and facilitating comparisons between studies. So, however, there are also some limitations associated with the use of SHR rats. So, the first one is the incomplete replication of human hypertension. So, while SHR rats exhibit many similarities to human hypertension, they may not fully replicate all aspects of the human condition. And they are also prone to developing other cardiovascular complications, such as cardiac hypertrophy and atherosclerosis, which may influence the interpretation of hypertension-related studies. Okay, so next one is the reduced sensitivity to pharmacological agents. So SHRs may not respond as effectively to certain pharmacological agents compared to the other rat models, which could impact the drug development studies. Okay. So, despite these limitations, SHR remain a valuable tool for hypertension research due to their spontaneous and sustained hypertension, ease of use, and also well characterized genetic and also physiological profile. Okay, so to address these limitations, normotensive Vista Kyoto WK1 rats are commonly used as controls in SHR studies. So WK1 rats share a similar genetic background to SHRs but do not develop hypertension, allowing researchers to isolate the effect of the SHR's genetic predisposition to hypertension. And additionally, salt-restricted or low renin rat models can be used to investigate specific aspects of hypertension, such as the role of dietary sodium or the renin-angiotensin aldosterone system. So, to measure blood pressure in mice and rats, we use the innovative tail cuff method using the IAPC Life Science Rodent Blood Pressure Machine. So, as you can see, the rat is securely placed in a restrainer with a tail exit point where the tail cuff is positioned. So, this tail cuff is a soft and inflatable band that fits snugly around the tail and houses a photoelectric sensor that is responsible for detecting the pulsating blood flow in the tail. So the amplifier, the heart of the system, will inflate the tail cuff until blood flow is completely blocked. So as the cuff pressure gradually decreases, so the photoelectric sensors will detect the returning pulsating blood flow, generating a pulse signal. So the amplifier analyzes this pulse signals to calculate the systolic, diastolic, and mean arterial blood pressure values. So the system provides accurate and also reliable blood pressure measurements for mice and rats, making it an essential tool for cardiovascular research. So next up is the utilization of animal models in cancer studies. So in this segment, we'll be focusing on genetically engineered mice and those implanted with human tumors. So these models offer distinct advantages, such as sharing similar genetic and physiological features with humans, as well as providing ease in genetic manipulation. However, it's crucial to acknowledge their limitations, including a restricted range of tumor types and the potential inability to fully replicate human diseases. So when it comes to specific animal strains employed in these studies, notable examples include skid mice, vaccine mute, inbred mute mice, and also C57BL6 mice. So additionally, SD rats can also be used, although it's important to note that the relative scarcity of genetically engineered rat models and the associated higher costs. And as you can see here, this is newt mice. So newt mice are a strain of lab mice that lacks a thymus gland, which is an organ that plays a critical role in the development and maturation of T cells, which is a type of immune cells. So the absence of a thymus gland in newt mice will result in a severely compromised immune system. So this is why newt mice are often used in research as especially cancer research, as they can accept transplanted tumors and other foreign tissue that would normally be rejected by a healthy mouse. Okay. And another intriguing avenue for cancer research involved the use of zebrafish as a model. So zebrafish with their transparent embryos allow for real-time observation of tumor growth. So their rapid development, cost effectiveness, and amenability to genetic manipulations made them valuable assets in the research arsenal. So however, it's important to acknowledge their limitation as well, such as limited organ complexity, rendering them not fully representative of mammalian biology. And typically, zebrafish larvae, specifically those in the 2 to 5 days old range, are preferred for this kind of studies. So here are some of pictures of cancer study using nude mice and also 57BL6 mice. So as you can see in the image, the tumor on the black mice has exceeded the maximum allowable diameter. So this is an important consideration in cancer research, as exceeding the allowable tumor burden can lead to animal suffering and also compromise the validity of research results. Therefore, it is very crucial to adhere to the established tumor burden guidelines. Okay, so researchers from the conducted a study to investigate the chemopreventive effects of tualang honey on oral squamous cell carcinoma using SD rats as an animal model. Okay, so moving on to animal models of skeletal diseases. So for the mice models, including ICR, BAPSI, and also 57BL6 strains, so mice have become indispensable in orthopedic research, particularly in applications such as fracture healing, osteoarthritis, and rheumatoid arthritis. So the advantages of mice include their small size and the ability for genetic manipulation that will enable researchers to delve into intricate molecular pathways. However, it's essential to note that mice models present limitations in joint size and also anatomical differences. Okay. Whereas for the rat models, specifically the SD rats, so these animals are commonly employed in surgical models for orthopedic research, and applications range from spinal nerve injury studies to bone defect repairs. And rats offer a balance between size and also cost effectiveness, making them a popular choice. So, nevertheless, it's crucial to recognize that rats exhibit limited joint complexity, which may impact the translatability of findings to humans. Okay. Lastly, let's explore the New Zealand white rabbit. So it is often utilized for articulating cartilage models. So this rabbit find applications in studying osteochondral defects and also meniscal injuries. So the advantages here lie in their larger joint size and also rapid bone turnover. However, researchers must consider the higher cost and ethical concerns associated with using larger animals like rabbits in their experimental studies. So presented is the nostril orthopedic department team. So the researcher conducted bone marrow collection in an anesthetized New Zealand white rabbit. So typically two teams were involved, one handling surgical procedures and the other managing preparation and animal anesthesia. So for the animal anesthesia during surgical procedures in rabbits, so the vets at EEU are primarily responsible. So this study utilized an anterior cruciate ligament transection, just ACLD model in SD rats, to investigate the impact of treadmill exercise on cartilage degeneration and subchondral bone remodeling in ACLD-induced osteoarthritis. So the researchers surgically created an ACLD lesion or defect in the right hind leg of the rat and subsequently evaluated the effects of treadmill exercise on the progression of the osteoarthritis. So the next image showed a soft tissue surgery procedure in a New Zealand white rabbit that is focusing on the evaluation of a novel acellular collagen-based graft. So this innovative graft holds promise for bladder tissue regeneration in vivo, potentially offering therapeutic options for individuals with bladder anomalies, bladder cancer, and also post-traumatic bladder dysfunction. Okay, so now moving on to animal models for obstetrics and gynecology. So the ONG team at UMMC has been utilizing caprine, which is good and porcine species. So these two species actually serve as valuable models for reproductive physiology, pregnancy, and also fetal development and uterine physiology studies. So due to their large size and reproductive anatomy and physiology like humans, so they are well suited for this research. And the ONG team employing, because they are using laparoscopy in their study, so they find the practicality of working with larger animals. So, however, it's noteworthy that this ONG studies can also be conducted in smaller animals such as in SD rats. And this is seventh laparoscopic gynecology surgery and hands-on animal workshop. So as you can see, the participants conducted a laparoscopic total hysterectomy, if I'm not mistaken, on an anesthetized goat. So this is a study of a new bioactive fibrine formulation that is provided superior cartilage regeneration using a caprine model. So it is a collaboration between the pediatric orthopedic department at Children's Hospital in Switzerland and the pediatric surgery unit at the Department of Surgery FOM in the state of Malaya and the EU and also any other departments. Right, so there are several advantages of using swine as the animal model in obstetrics and also gynecology studies. So, in the terms of the anatomical and physiological similarities, so swine they share many anatomical and physiological features with humans, more so than other commonly used animal models like mice or rats. So these include similarities in organ size, function, and also hormone production that makes them a better choice for studying conditions like endometriosis, fibroids, and also ovarian cysts. Okay, so the next one is the similar gestation period. So the gestation period of a pig, which is around 3 months, is closer to that of a human, which is 9 months, compared to the rodents. So this allows for longer and more complex studies of pregnancy, fetal development, and also childbirth. Okay, so next one is the large litter size. So pigs can give birth to large litters, which is sometimes up to 15 piglets, which enables researchers to study individual variations within a litter and conduct experiments with multiple animals simultaneously. And they have a very well established surgical techniques for manipulating the reproductive systems in pigs, and that will allow researchers to minimally invasive procedures and also gynecological surgeries. Okay. And also, there are several disadvantages of using swine. In terms of the differences in menstrual cycle and also ovulation, so pigs they have a continuous estrous cycle, unlike the menstrual cycle of humans. So this can make it a little bit difficult to study menstrual related conditions and hormone fluctuations. Okay, and also there are difference in fetal development. So because the gestation period is similar, the development of the porcine fetus differs from that of a human fetus in some aspects, okay, such as brain development, also placental structures. So this actually limits the applicability of certain findings to human pregnancy. And also in terms of the ethical considerations, so using any animal model raises ethical concerns, and pigs are no exception. And researchers must ensure that pigs are housed and treated humanely, and the studies are conducted with minimal pain and also stress. And in terms of cost and maintenance, so although more affordable than primates, so swine still require specialized housing, care, and also handling, which can be costly for um, research institutions. Okay. So this is Asian Minimally Invasive Gynecology Masterclass and the 9 hands-on animal workshop. So as you can see, this is the team of specialist veterinary anesthesiologists from UPM who they are mainly involved in the preparation, monitoring, and also anesthesia of the animals during the workshop. All right, so next is ethical considerations and animal welfare. So the use of animal models in research is a delicate balance between scientific advancements and ethical considerations. So in Malaysia, the Animal Welfare Act of 2015 actually mandates researchers to obtain a license for animal work that is implying potential charges. And at the we actually recognize the importance of upholding animal welfare and adhere to these strict ethical guidelines. So our two ICOOC, which is the UMHealth and also the FOMHealth, are responsible for overseeing animal research activities and also ensuring compliance with the 3Rs principle, which is replacement, reduction, and also refinement. So this 3Rs principle provides a framework for minimizing animal suffering and also optimizing the use of animal models in research. Okay. So replacement meaning that whenever possible, any alternative methods such as cell cultures or computer simulations should be used instead of the animal models. And reduction, the number of animals used in research should be minimized to the absolute necessary. And refinement, meaning to say animal welfare should be prioritized by refining experimental procedures to minimize pain and also distress. So at our ICOs rigorously review all animal research proposals to ensure that they adhere to the 3Rs principle and the potential benefits of the research outweigh the potential harm to the animals. So we are very committed to conducting research in a responsible and ethical manner, ensuring that animal welfare is always at the forefront of our decisions. Okay, so now let's explore the upcoming trends in selecting appropriate animal models for human diseases. So firstly, we have in silico models, which involve computer simulations. And secondly, there's organ-on-chip technology, which is a cutting-edge approach. And lastly, we have patient-derived xenograft, which is showcasing a forward-looking direction in this field. So for the in silico models or computer simulations, so these models actually rely on advanced computer simulations to simulate biological processes and also responses. They offer a virtual platform for testing hypotheses and predicting outcomes without the need for physical animal experimentation. Right. So whereas for the organ on chip technology, so this innovative technology actually involves creating micro scale devices that mimic the structure and function of the human organs. And these chips actually provide a more accurate representation of human physiology, allowing for detailed studies and drug testing in a controlled and ethical manner. Okay, and whereas for the patient-derived xenograft, so this approach involves transplanting human tumor tissue into animal hosts, typically mice, in order to create models that closely resemble human diseases. And this model retained the genetic and molecular characteristics of the original patient's tumor, making them valuable for studying disease progression and also testing personalized treatment approaches. All right. So these future trends actually represent exciting advancements in the quest for more accurate and ethically sound approaches to model human diseases. All right, so let me provide an overview of the services available at our facility. So we are an international accredited lab animal facility. Annually, we host our renowned RCU lab training program, comprising both theoretical lectures and practical sessions conducted approximately 4 to 5 times. And additionally, we offered courses on fundamental surgical techniques and basic rodent and rabbit necropsy. And furthermore, our facilities include an SPF suite, an OT room, and also APSL2 suite. So the meticulous choice of an appropriate animal model is paramount for ensuring the validity and relevance of research outcomes, underscoring the imperative of thoughtful model selection in achieving meaningful scientific advancements.
Okay. I would like to thank Dr. Azmina for the enlightening presentation. So we have two questions here. The first one is, in terms of genetic and lifestyle of humans, life events, life activities, how sure are the scientists that the animals models resembling or mimic human response to drugs, etc.?
Okay, thank you, Dr. Azura. Scientists actually they use animal models to study human diseases and its response to drugs because these models actually share genetic, biological processes and also behavioral that is similar with humans. However, it's very important, as I said in my presentation, to note that there's no animal model that is perfect representation of human biology and behavior. And researchers should aware of these limitations of the animal models and use a variety of approaches lah, in order to assess how well an animal model that mimics the human responses. I hope that answers the first question.
Okay, thank you, Dr. Azmina. There's another one. Can we combine human sample to animal model?
Yes. Most of the time, researchers they combine human samples with animal models in research studies. So this approach that is what we call as xenotransplantation, where it involves transplanting the human cells, tissues or organs into animals lah, for various research purposes. For example, human tumor cells can be implanted into mice in order to study cancer growth and response to the treatments. And similarly, human immune cells can also be introduced into mice in order to study immune responses. Okay. Any other question, Dr. Azura?
I think that would be it. All right. Okay. Thank you, Dr. Azmina, for the answers given. Right. I would like to invite participants to connect with the speaker and each other for further discussions, collaborations, or networking opportunities. You can visit our website, www.eu .eu.edu.my. And I would like to thank our gratitude to the organizer, Breakfast at UMHealth 2024, for the session and their efforts in arranging the presentation. Okay, so as a key message, selecting an appropriate animal model requires a thorough understanding of the disease being studied, as well as careful consideration of the model's relevance, practicality, and ethical implications. By choosing the right animal model, researchers can enhance the translational value of their findings and accelerate the development of treatments for human disease. So thank you all for your attention and patience. We apologize for the presentation running over the allocated time. We appreciate your understanding and would like to ensure that future sessions stay within the scheduled time frame. Thank you again for your understanding. Thank you.